Hi, I'm Dr. Mitchell Kim. I'm a general dentist here at Modern Dental in Richardson. When talking about full mouth reconstruction and smile makeovers, sometimes they can mean the same thing, sometimes they're completely different. When we're considering a full mouth reconstruction for a patient, it's typically due to structural changes that the patient has had over a span of time. Maybe they've ended up losing some teeth because they've had to have them extracted for any particular reason. If they've had trauma, maybe they were in an accident, or maybe it's been a slow ongoing process. Patients who have had issues with grinding and clenching of teeth have deteriorated kind of the height of their teeth on the top and bottom jaw. A lot of times that requires a comprehensive rebuild, to kind of regain the size of the teeth, missing teeth that need to be placed back, whether it be with dental bridges, dental implants. It's not really a way to focus on a specific area alone because everything is so interconnected as far as their bite goes. And with the smile makeover, sometimes a patient is really just concerned with the appearance of their teeth, the shade of their teeth. There's nothing really wrong with their anatomy. They haven't lost any teeth. They haven't lost any vertical height of their teeth over the years. And so it's really more of a cosmetic issue in that regard. In either scenario, it's not really a simple process because we're dealing with multiple teeth. There's going to be a high level of detail that's required in the planning stages, regardless of whether you're needing a full mouth reconstruction or even if you're just planning on cosmetic changes to your smile, whether it be the shape or the shade of your teeth. So they're both quite complex. I wouldn't say that they're simple, but there's definitely planning that we can do for either scenario. Patients may require a full mouth reconstruction due to a variety of reasons. One could be trauma. Maybe they were in a car accident, no fault of their own, but they end up losing some teeth due to fractures. If patients have been a little anxious about coming to a dentist and they haven't been able to motivate themselves to, maintain their annual checkups and cleanings, we may have some issues with cavities and bone loss around teeth that have deteriorated the mouth as far as structural stability and things like that can really affect all areas of the mouth. And so a lot of times that ends up being a comprehensive issue looking towards a full mouth reconstruction. Some people have genetic predispositions to missing teeth. There are some patients that never develop certain adult teeth as they're growing up, and that needs to be addressed as they enter into their adult years. And so that could require a full mouth reconstruction depending on how many teeth are missing. As far as patients that have had existing restorations that may have failed, they have worn down, causing some discrepancies with the way their teeth come together, right side versus left side. Maybe they're hitting too heavy on their front teeth. Things like that we can equilibrate, their occlusion, or that's what we call a patient's bite. So it's really, multifactorial. It could be one reason alone. It could be a couple. But it's hard to really generalize into one set of problems causing a patient to require full mouth reconstruction. But it's a discussion that we have with each patient. Is it the right option for them? Are there other avenues that we could explore? But it is something that we can offer a patient if that's what's in their best interest. Just like any other major project, full mouth reconstruction doesn't really differ very much. There's a very intensive planning stage on the front end because that will kind of help us determine, how long will this case take? A patient's schedule really determines a part of how long that case will run, depending on their work schedule, their schedule at home, how often can they come for visits. Some people require a little bit more time in their trial restoration. Sometimes we like to give patients some time to walk around with provisionals to see, does it affect their jaws? Does it hurt, their right or left side or both? Do they like the appearance of what they will be getting permanently? And so some people, they're okay maybe after a few weeks. Some people need maybe a couple of months, and that can really determine, how long this case will take. Financially, it may require more time for them to be able to complete the case, and so we can potentially segment their case so that they're able to kind of keep up with being able to afford completing the whole thing in a proper manner and not trying to rush it, and downgrade on the quality of the restoration that they're getting. They really experience a change in the quality of life, functioning as far as speaking, being in front of people, self-confidence, and really being able to enjoy meals with their families and not being in pain that's causing other issues, with their jaw, as far as maybe the lack of size in their teeth is really putting a strain on their jaw joint, which is not any different than your hip or your knee or your elbow. Getting everything in the right position will really increase and benefit the patient as far as the quality of life standpoint is concerned. And long term, it really will maintain a proper oral hygiene environment. Being able to keep everything in the right position will really help with reducing plaque levels and keeping the gums healthy and maintain the bone levels as high as we can as patients get older. So there's a lot of benefits to be had for patients that do require full mouth reconstruction. And, it's really, just a matter of being able to get the patient started on the right path towards that. First step is to call and schedule a consultation. It's not going to be the typical first patient visit that they would have with us. We'll set aside time specifically to address the potential for needing a full mouth reconstruction. That would entail getting a full set of x-rays. We'll do some digital scans of their teeth, and then also kind of go through the general guidelines or outline, I should say, for what to expect. The first visit may take an hour just to kind of answer a lot of questions and things like that. But the first step will be, obviously setting up that consultation.